welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Dr. Marissa Barrera, who will be talking to us today about speech problems in MS and some helpful ways to improve your communication. After a presentation from Dr. Barrera, we'll open it up to your questions and comments. Now I'm delighted to introduce our speaker. Dr. Marissa Barrera is the Program Chair and Associate Professor in the Graduate Program in Speech Language Pathology at Yeshiva University, New York. She is recognized expert on the use of a variety of techniques for speech and swallowing rehabilitation and provides clinical training courses globally. As a researcher and author, Dr. Barrera has lectured in over 15 countries on a wide array of clinical topics, ranging from multiple sclerosis, dysphagia, NMES, motor speech disorders, cognition, and neurodegenerative diseases. She has several peer-reviewed publications and over 80 research abstracts. She has been featured by CBS News, Women's Health, Vice Magazine, Advance for Speech Language Pathology, and MTV's Funny or Die. She's a multiple sclerosis certified specialist and owns New York Neurogenic SLP PC, which specializes in telehealth. She is a member of the Clinical Advisory Committee of the National MS Society and the MS Focus Advisory Board. In 2019, Dr. Barrera was awarded the Healthcare Professional Champion Award from the National MS Society. We're very pleased to have her join us to present this wonderful topic. And Dr. Barrera, thank you so much for being with us today. And now I'm going to turn it over to you.
Thank you so much for your warm welcome and your kind introduction. I am so pleased and proud to have the opportunity to share my passion, my love, my life's work, which is improving quality of life for persons with acquired neurological conditions. And for the past 15 years, I have devoted all of my time in clinical care specifically to multiple sclerosis. I think of me as your partner in crime and helping you advocate and achieve your goals, whether it be speech, swallowing, or cognition. I am here today to talk a little bit about what we can do to work together, what you can do to help yourself in your road to MS care. So thank you very much. I'm pleased to begin. So here's a little information about myself, as we just learned. I think it's the most important thing to point out about my history and my credentials is the fact that I'm a multiple sclerosis certified specialist. And this is important when you're looking to put together your dream team for MS care. It's always good and it's great to ask, is there somebody at your center, at your hospital, at your private practice who's an MSCS certified specialist? So I wanted to point that out because there are several thousand PTs, OTs, SLPs, and other similar healthcare professionals who share this type of certification. So that's just one little piece of information, some food for thought. So what are the facts? The facts are that impairments for communication and swallowing have long been identified for persons with MS. On average, the research tells us about 44% for persons with MS experience challenges and impairments of their speech and in their voice in the very early onset of their disease course. Additionally, about 33% of individuals with MS report challenges in voice, chewing, and their swallowing capabilities. And these are all very important for livelihood, for work capabilities, and of course, quality of life, nutrition, and hydration. About 45 to 65% of persons with MS experience difficulty with the clarity or their pronunciation for speech, memory, attention and focus, word finding, and problem solving. So these are well known and frequently reported with our patients. But here's the disappointment, and this is why I have dedicated my life's work to working with persons with MS. The referral for treatment is pretty much abysmal. Only 2% of individuals with MS are getting and receiving the appropriate referrals for the rehabilitation for speech, voice, and swallowing. And only less than 1% of our patients receive the appropriate cognitive intervention. A topic not for today, but one I speak on frequently, is making sure if you or your loved one is on an oral formulation for disease-modifying therapy. What does that mean? Taking a pill. Now, all the advances in MS care has led us to have oral formulations or pills. It's so important that you meet with speech language pathology and have a referral to ensure that that pill is going into your stomach for processing and not accidentally entering your airway. So you can see that we have a huge role, speech language pathology, in the essential care of MS. And today we're going to talk specifically about one topic that I'm really, really passionate about, and it's speech disorders associated with MS. So what is the actual term, the medical terminology that we use as clinicians to classify an actual speech disorder? And that term is dysarthria. Dysarthria is the term we use to describe and diagnose changes in speech clarity, tone, volume, acoustics, all associated with multiple sclerosis. And studies illustrate that anywhere from about 35 to 51% of persons living with MS experience dysarthria, the changes in speech clarity, tone, execution associated with the disorder. So let's learn more about dysarthria, and more importantly, what you can do to help improve yourself at home and with the guidance of your healthcare team. So dysarthria in a really formal sense. If I was meeting with one of you via telehealth consultation for the first time, and we met and I collected some data and I was going to present to you my findings, I would say, okay, Mrs. Smith, well, it seems to me that you have dysarthria, and dysarthria is relatively common in MS. It is described as a neurological motor speech disorder in which your muscles have now become either slow, weakened, uncoordinated. And as a result, it's changing your ability to speak clearly. It has changed your speech musculature. And that's exactly what I would say. And I want to share that information with you today. The speech musculature is not just what you may imagine in your mouth. That includes the lungs, which are the powerhouse, the very foundations for which all of speech, swallowing, and communication take forth. Our vocal folds, the velum or the soft palate, our tongue, our lips, our nose, and our jaw. So you can see it's not just the mouth. A lot of the rehabilitation for speech or dysarthria takes place with the rehabilitation of the foundation, which is our lung and lung capacity. And we'll be talking more about that in the upcoming slides. So most often our respiratory and articulatory muscles do become disordered. And when they become disordered as a function of MS, we see that speech can be described as slurry or sloppy sounding. Perhaps there is a pressed or a harsh vocal quality that may come and go throughout the day. And vocal volume can also be described as being low. Dysarthria absolutely will reduce the intelligibility or the clarity that you perceive and the world perceives around you. And for many individuals over the course of my career, they report that their lack of confidence for the way that they sound causes them to socially isolate and even become depressed. And we are here to target that and to improve that together. So here you can see, if you look at the 168 individuals with MS, and when we ask them to give us the rank order for the things that they describe most often with their voice and their speech, 77% said they had changes in loudness, a harsh vocal quality, which is due to spasticity, For many individuals with MS, we know that spasticity is something we're constantly managing, and our vocal cords are muscles, and they too are subject to spasticity, which can lead to a harsh or very pressed vocal quality. 46% of our participants indicate that there's imprecise or lack of clarity for articulation. Okay, and then of course, pitch control. That's the ability to have inflection, to rise and fall. Well, once again, if there's spasticity in your voice, in your neck, in your muscles, you don't have the flexibility to put pitch control in one's voice. So that is not uncommon. So this is, if there's something here on this table that you can identify with, then we absolutely have the opportunity to treat that with speech rehabilitation. In MS specifically, we see that dysarthria, or this neurological speech impairment, can occur in two contexts. Most often, many patients report it as an episodic dysarthria, right? Especially early in the disease course, if we are faced with a relapsing remitting MS diagnosis, we can see that dysarthria can quote unquote flare up at the onset or during one's MS flare, but it also cannot be associated with an MS flare. It can be associated with high periods of fatigue, right? MS lassitude. Lassitude is a term that we use to describe a very specific type of intense fatigue associated with MS. Some of our patients indicate that their dysarthria can last just a few minutes or an hour. It can occur several times throughout the day, or it could be present one day and gone the next. Episodic dysarthria is certainly common, but more often than not, all of the wonderful individuals I have treated over the course of my career really report and identify with a consistent dysarthria. And that means the symptoms of their dysarthria or their challenges that they're facing with their speech and their voice are persistent throughout the day, day after day. But if you have ever woken up one day and felt that you were having an off day with your speech and your communication, I want to make you feel rest assured that you're probably right. You can, and many people do, have these bouts of episodic dysarthria. So what is the cause of dysarthria? Okay, well, the cause of dysarthria, likely for persons with MS, there's many different types of dysarthria, but this is not a graduate class in motor speech disorder. So I'm not gonna take you down that long winding road that my poor students at Yeshiva University and Nova and Baylor have to do with me. But in general, dysarthria for individuals with MS have to do with bilateral upper motor neuron damage and changes in the cerebellum. So there are changes in the integrity of those motor neurons that lead to changes in speech and voice and clarity. Additionally, we often see that respiratory deconditioning is a second factor. It's an add-on or a comorbidity. Sometimes with advancing MS or even due to the pandemic, a sedentary lifestyle, moving less, walking around less, getting out of our homes less, man, can we all identify with living our lives in our homes to such an extreme over the course of the last year and a half? It could totally change one's respiratory capacity. So additionally, it's always important to note that positioning and posturing is sometimes an easy thing to look for in terms of improving one's speech clarity. If you're hunched over, if you're illustrating what I call a kyphotic position, it's really hard to get your sounds out because all of your body weight is sitting on your lungs. But when I sit up and move my chest back and allow my shoulders to be open, Immediately, I sound clearer. I have more volume because I'm taking pressure off that powerhouse, the diaphragm, the lungs, which are the star of speech, swallowing, and communication. So, perceptually, meaning with your ears, dysarthria may sound sloppy, imprecise, uncoordinated, and very effortful, despite all of your potential best efforts to communicate clearly. Your voice may be perceived as harsh, hoarse, breathy, pressed, and even nasal, especially when there is high spasticity in the mouth and in the anterior neck. So, when you pair dysarthria with multiple sclerosis, we have some very common themes that can occur. And vocal weakness associated with reduced respiratory support can significantly reduce your vocal volume. Your endurance for communication, that feeling like you're running out of air or you're constantly catching up your breath, is very, very common. And the science tells us about 8 decibels are lost for individuals with MS because of these changes in respiration associated with the disorder and dysarthria. So I don't want you to think I'm painting a grave picture. In actuality, the whole purpose of this lecture is to educate you about what can occur, but most importantly, teach you how we can work together to fix it. So let's talk treatment, shall we? So one of the easiest things you can do, and if you've seen me lecture, whether it's here for MSF, the National MS Society, CBS News, or any one of the global MS conferences, you know there's not a single conference that I give where I don't have everybody do the sustained ah technique. It may be my little claim for fame, but I'll tell you why. It is the #1 proven thing that you can do to help improve your lung capacity and the muscles of the glottis, AKA your vocal cords. And guess what? It's free. So I'm always passionate about sharing this technique with each and every one of you. So this sustained ah technique helps increase your breath support for not only speech, but for vegetative purposes. The better you can take air in and out more efficiently, the better it will help with your physical exertion, your ability to rest, right? All of the other therapies that you may be participating in, it all benefits from when we have increased breath support. This technique helps us focus on the intercostals and the diaphragm. The intercostals are the little muscles that run between our rib cage, and they're critical for breath support. The sustained ah is notoriously well known for improving your vocal volume and improving speech clarity or intelligibility at the same time. So it's like you get a 2-for-1. And a bonus, a part of this technique, it also can improve swallowing. Because when we engage in this technique, this big ah, and we start to play with the ah a little bit, and we take it up and down a pitch scale as such, ah. When we elevate our pitch, we actually take our larynx and we go up, 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 down, 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 down. And that's exactly what we do when we swallow. If you take your hands and you place it just on your anterior neck and you swallow, you'll feel your Adam's apple go up, 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 and down. So this technique emulates the laryngeal movement, what we call the hyolaryngeal excursion, which can help improve swallowing. So there's so much to love about this technique, which is why you'll always hear me talk about it. So we are going to practice all right now. This is not about being a singer. I am not a singer. A dancer, yes. A singer, no. But what we are going to do, it's not about singing. It's just about maintaining your natural voice. Whatever your natural voice is the voice I want you to use. So the easiest way to find your natural voice is to just say ma, 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 and hold that ah. Take a deep breath in. And then when your lungs are absolutely filled with air, let it out. Make sure your mouth is nice and wide open and you are letting all of that glorious sound out. So I'll demonstrate for all of you. Until you have no more air left. So you want to do that for as long and as loud as you can, provided you are not in pain in hurting your voice. Pain is not good, but feeling a little bit of push, a little bit of windedness, that tells us that we are exercising. So there is a little bit of no pain, no gain in terms of feeling you're pushing yourself. But we never want to do this where you have physical pain in this apparatus. That would not be beneficial. So how do you implement this technique at home? Well, first and foremost, I would love for you all to take a second and to do exactly what I did. I will set my stopwatch for 30 seconds, and I want you to time yourself, whether it's counting on your fingers or whatever it may be, and compare yourself to the data I've presented on the screen. We know on average, men should be able to sustain that ah sound from 20 to 40 seconds, while women anywhere from 15 to 35, and children between 10 and 18. So I'm going to get my stopwatch available, and many of you have stopwatches available on your smartphones. And we are going to have you all time yourselves. So if you're playing along, please do what I do. Take a deep breath in and begin. And keep going until you run out of air, and make note of your time. "13 seconds, 16 seconds have passed. 20 seconds have passed. 25 seconds have passed. And 30 seconds have passed. How well did you do? If not now, perhaps try it later. Give yourself a little check-in regarding the voice integrity. So this data is here for you. So what can you do on a daily basis? Well, let me begin, and I want everyone to hear me clear. Everything I'm doing today is to empower you to do things at home, for you to advocate for yourself, and for you to be in control of your own healthcare. However, it is ideal that you minimally have a consultation with a medical speech pathologist to guide you. But in the absence of being able to do that, there is no reason why you could not implement the program illustrated in today's lectures to get you started and on your way. So here is your sample exercise protocol, friends. You're going to say ah for as long and loud as you can until you have no more air left in your lungs. Remember, if you feel pain, you stop immediately. You're going to record using your stopwatch or a physical stopwatch if you have one, how many seconds. Upon completion, you're going to rest and recover. And then you are going to repeat this for a total of 15 times. After 15 times, you're going to take all of those numbers, 10 seconds, 14 seconds, 15 seconds, 18 seconds. You're going to add them all up, divide by 15, and get your daily average. I'm going to encourage you to write it down and track it and look day after day, week after week. Are your numbers increasing? Is your volume improving? Is your lung support increasing? I can pretty much tell you that you can begin to see changes pretty quickly with the implementation of such a protocol. So I do see that there's 2 questions that popped up into our chat box. I'm going to just, for the purposes of making sure that we keep our flow going, we will absolutely address all questions, including these and any future ones at the conclusion of our webinar. Promise you, I will stay on until 6 o'clock at night if I need to make sure everyone gets their questions answered. So this is your protocol. It's in your handouts, which will be shared with you. They're my gift to you. So please, please give it a try. Well, what about the research? So this is one of my big passion projects, a part of my PhD, which was in MS care for cognition and speech. I did a research project leading up to that culminating dissertation, and it was a project looking at this exact technique of using the sustained ah for individuals with relapsing remitting MS, and their disease course ranged anywhere from 13 to 18 years. So these were not newly diagnosed friends with MS. These were individuals who've had MS for a fair amount of time. All of my participants received 16 hours of a type of therapy called LSVT, which is where this technique comes from. And in this type of therapy, they must have 1 hour of therapy, 4 days a week for 4 weeks for a total of 16 super intense rehabilitation sessions over the course of 1 month. And when we looked at the data for a few different tasks, that big sustained pre and post, when we looked at their natural monologue, and the cue was, Mrs. Smith, tell me about the happiest day of your life, recorded, and we analyzed it, and give me your help. Imagine there's an emergency, yell for help. When we looked at the data before and after, really amazing things were made clear. Statistically, there was significant improvements from the pre and post treatment for all 3 conditions, the their monologue, and most importantly, functionally being able to indicate they needed help. All of the individuals with MS who received this therapy, the LSVT loud therapy, increased their loudness on average 8 decibels. So here's that Dr. B's pop quiz moment. Does anyone remember why 8 decibels is really a significant number when we talk about MS care? Well, in my previous slide, when we talked about what are some of the general trends we see in MS and dysarthria, we learned that on average, somebody with MS may experience an 8 decibel loss of volume. And completely coincidentally, in one of my research studies, we saw that there was an average of 8 decibels of gain. So that means we're getting our friends with MS, their volume closer to quote unquote normal. And that is absolutely a priceless outcome. If you look at the data, look at all of my friends here. We had patients 1 through 4. You can see many of them started nearly at a whisper at 63 decibels. That's very, very soft, and ended their therapy at 70. We have individuals who ended their therapy with 85 decibels. That is so loud. That means that they were able to achieve great, great, great feats in vocal volume. And that is important for your ability to communicate, and most importantly, to be able to be heard in an emergency situation. In these days, there's so many natural noises around us. There's street noise, there's HVAC and heating and cooling, there's kids and babies and computers and your husband on a Zoom call and you're on another call. All of these competing noises makes it even more important now than ever to make sure you have the vocal volume that you need. So here are some actual samples of my participants. So let's listen to their voice before they started their work with me. Oops, let's try that again. One moment. Okay. Deborah, can you give me a thumbs up to make sure that everyone can hear my set? Good, super, thank you. I want to make sure everyone can hear me. All right. And here, let's listen one more time before treatment. I would describe that voice as gravelly, as pressed, as harsh, and certainly soft and not with a lot of endurance. And here is him after 16 treatment sessions. What are some of the things that you notice? You can notice that it's much longer. There's a general smoothness applied across his ah. There's less of that gravelly feeling. So these are the types of outcomes that some of our patients can achieve. Let's listen to someone else. This voice is less of that gravelly quality, but it's very soft. And there's this breathy quality underneath it. Now, hold on tight. Here's my friend after our work together. You can hear that laughter, that pride upon the end of our work together that he was able to achieve such great things with his voice. So these are just some examples. So the results of this therapeutic intervention show that upon completion of these 16 treatment sessions, friends and family members were each asked to listen to the digital recording of the monologue, right? Tell me about the happiest day of your life. And they listened both before and after the therapy. And we asked them to judge their loved one on intelligibility. Did they feel that their speech was not clear? Their loved one's speech was clear some of the time, most of the time, or the entire time. And all but one of the friends and family members rated their loved one's speech as clear the entire time. So I'm a functionalist at heart. Yes, I'm a researcher. Yes, I'm a program director and many other titles, a mom, a clinic director, and other things. But what's most important to me in my role in helping my patients is that their loved ones are reporting a change. And it's carrying over into their home life and their community. So all of the data in the world is really useless to me when I really just wanted to see, are they being better understood at home? And this was a big win. So one last time, let's listen to one of those monologues.
Teflon is a permanent type of injection implant material. It has some long-term risk of a foreign body reaction which can cause the voice to deteriorate some years later. The body.
So you can hear, has good rhythm and rate, but very breathy, very low in vocal volume, and some moments where you have to kind of piece together what he may be saying. Well, this gentleman actually professionally used his voice. He was a DJ. So let's listen to him after our work together.
Ladies and gentlemen, may I have your attention. Good evening. My name is Nate from Primetime Entertainers. On behalf of Tony and Tina, I'd like to welcome you to the beautiful Motel 6.
I mean, I think the proof is in the recording. He was able to achieve volume, clarity, steadiness. And there is not a single time where I question what my dear Nate was saying in this section. So lots of great things can take place from implementing some pretty simple and, most importantly, free techniques for voice and speech rehabilitation. Let's take a moment and go back to the lungs. I've said maybe 2, 3, 4 times now that the lungs are the powerhouse for your communication. Without your lungs, there are so many things that we simply cannot do with the ease that we all may take for granted. A part of this study, we also noticed that there was a significant improvement, an average about 680 cc's of lung capacity. That's how much air your patients were able to forcibly exhale. That's an amazing amount of improvement on utilization of lung capacity. So that was a great outcome that we achieved. So it's really critical for us to think about what happens if someone's lung capacity is low, and why do we focus on the lungs? You're saying, Dr. B, you're not a respiratory therapist, you're a speech language pathologist, and you're right. But we treat belly button to brain, right? Across the lifespan. So it is important that we talk about the lungs, because if you or your loved one has low lung capacity, they can present with a weak cough. Well, if you have a weak cough, how do you clear something from your airway? Something like, I don't know, a poppy seed or bagel seed, or secretions, which we want to keep out of our lungs for so many important reasons. Low capacity can be associated with low vocal volume, the accumulation of secretions in the mouth and the nose, and all of that can increase the likelihood of pneumonia. And pneumonia is simply deadly for all of us, but it's even more concerning when you pair pneumonia with a neurological condition. So this is why we should all be focused on your lungs. Just some data from that research study, you can see that many of our patients, every single one of them, had large increases in their forced vital lung capacity over the course of 1 month of treatment, 16 total sessions. So let's talk rehabilitation. How do you fix it? How do you do it? Well, respiratory muscle strength training is the science of building and improving lung capacity utilization through applying pressure to the breath. So it is widely understood in the research literature. There's a lot of research specifically on the implementation of RMST for MS. And not just MS, but MS, ALS, Parkinson's, and many other conditions. This is such a critical part of your rehabilitation. It targets both your ability to improve the inhalation or the taking in of air, as illustrated in the lower left column, as well as improving your expiration, your ability to move air out sufficiently and efficiently. And we, of course, call that expiration. And we talk on the expiration, right? So the better our speech clarity, right? How do we achieve better speech clarity, more vocal volume, better enunciation? By improving our ability to take air in, and certainly improving our ability to use it on the way out. So what's the procedure of using RMST? Well, really it all has to do with exhaling and inhaling into a very small controlled device with a very specific valve. And there's 2 different types of valves. There's those that are spring-loaded, and I have one right here beside me. And those devices that use different different holes, if you will. Imagine blowing through a straw that's like a coffee stirrer, and how hard it would be through that coffee stirrer. And then, if you've ever been to McDonald's or any of those fast food chains and you have a milkshake straw, it's huge. Imagine blowing your air through that. so much easier. So the devices either have holes of different sizes that you click, 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 click to make the breathing super hard. In the case of like blowing air through a coffee stirrer, to larger, to super large and easy, like the case of a hole you would imagine in a milkshake straw. Or the device can be spring-loaded, where here we twist to make things harder and twist in the opposite direction to take some of the pressure off. What's cool, once again, about this technique, similar to the sustained ah, RMST gives you a bonus. Even though technically we are not swallowing a part of RMST intervention, but we do have research literature that supports the transference, the moving of the skills from simply breathing forcefully into these devices to actually improving swallowing. And I will say this, speech and swallowing go hand in hand. So all of these added benefits, when you exercise your lungs and your larynx, you will potentially see that move over to the swallowing safety. And swallowing safety is of the utmost importance because it has the capability to prevent pneumonia. And pneumonia, once again, is of dire concern for any one of us, but certainly somebody with a comorbidity such as MS, Parkinson's, or ALS. So lots and lots of research available on MS and RMST. So here are some different devices. Let me begin by saying I'm not paid by any one of these companies. I don't have any support from any one of them. I'm simply here to tell you what I have used, what I've seen, and what has consistently been the gold star products in my world of 15 plus years of MS care. So full transparency, this is not a sponsored talk. This is me giving you my professional opinions personally and not that of MSF. So the sample protocol you can use in such a device like this. This is a spring-loaded, pressure-loaded device. Once again, you twist in one direction to increase the force, and you twist it in the other direction to reduce the force. This is placed in your mouth, and you blow forcefully through the device. You can see all that effort. I can feel it in my diaphragm. I can feel the tension through here. I can feel that. That is good to feel those muscles working. So the sample protocol I often recommend, and I do once again recommend that you ideally consult with a medical SLP to individualize your training programs. But in a very generic sense, I recommend 5 days a week, 40 reps a day for 5 days, for 5 total weeks. So 5 weeks, 5 days a week, 2 days off for 40 reps per day. And what we'll do is you'll learn, and there's videos and protocols I'm going to share with you when to increase the pressure to make sure as you're getting stronger, it's not getting too easy. And if it is too hard, how to know when to scale back a little bit. The purpose is to not have you pass out and keel over. The purpose is for you to feel like you have moderate resistance to your breath support. And that's what we're aiming to do. So how does all of this help? Once again, that excessive force and continued airflow required by forceful exhalation into a device such as this can improve your cough, your airway production, and essentially your breath support for speech and swallowing. So very, very important. So we're just going to stop for a moment. I'm going to show you a very brief introductory video on how to get familiar with such technique. So bear with me one moment. 1 second as I share my screen. Okay, super. Deborah, can you just give me a thumbs up if you can in fact see my screen? Thank you. Thanks, friends. Okay, very, very brief introduction to how this works. 30 seconds.
Training with the EMST 150, EMST 75 Lite, or the IA 150 adapter is simple and easy. You can train anywhere because the devices are small, handheld, and easy to take with you. Or you can simply train in the comfort of your home. Training takes only about 15 to 20 minutes a day. Best of all, you can see significant respiratory strength improvements in as little as 2 to 3 weeks. Order your device today.
Okay, you can see it's discreet, it's small, it's simple, something you can do to take control over your speech and lung capacity. So let's jump back to our lecture and continue to learn about these techniques. Let me get my screen shared with you all. One moment. Okay. All right, let's jump right back in. So as you can see, the EMST and other similar devices are easy to use. It's used across a wide range of individuals. They're relatively cost effective, no more than really $60 to $70. I'm not saying it's free, but in the scheme of things, if you think about all the things you may have tried, AFOs, things that cost a lot of money, this is a relatively affordable way to help improve your lung capacity for speech and swallowing. But most importantly, this is going to transfer over to your general non-vegetative success. Just having the air that you need available to live your daily life, but also improve your speech. So there is a full video on the web, many videos on how to do the full program. You're encouraged, or not necessarily encouraged, but you're welcome to check that out if you would like. And there's even a how-to sheet on how to implement the protocol, and it's spelled out step by step. So either the video or the handout will teach you how to adjust the device, find your baseline, and track your success. If you have the opportunity to consult with a medical SLP, I really encourage you to do so. They can further tweak and customize this for you, and away you go in your home exercise program. A similar device that we just talked about, or a similar technique, is utilizing one with different air ports. Those are the different size air holes that provide various levels of resistance. So the breather is a resistant breathing training device similar to the EMST, but this one is using those air ports. And at the smaller the airport, the harder it is to inhale and exhale, and the larger it is, the easier it is. And what's cool about the device is that you have the ability to adjust independently the number and level of difficulty for inhalation, independent from the exhalation. So if inhalation is easier for you, you can pump up the volume, if you know what I mean, no pun intended, and making it a little bit harder. But if exhalation is more challenging, you can ease up. So it's very, very customizable. And the breather, through research, supports respiratory support, once again, essential for your phonation, your speech clarity, and that bonus skill, swallowing. It also strengthens the skeletal muscles of the neck and the anterior neck, the pharynx and the larynx. So lots and lots of positive, well understood and scientific support to help us make this a part of our training regimen with lots of evidence. And once again, the breather has been shown in the science to help us reduce the likelihood of one developing an aspiration. Aspiration is when food, liquid, saliva, or secretions slip into one's airway past the vocal cords. And that is a large, large predictor to developing pneumonia. So everything we can do to keep our lungs happy and healthy and safe is something worth trying. Here's that device. As you can see, we've got a wheel of different air ports that are underneath the numbers here on the inhale. And on the opposite side, we have that same wheel. And we can twist, click, click until we find a comfortable level where you're getting resistance. But once again, you're not in pain, you're not passing out, you're getting resistance to the force. And you're working both inhalation and exhalation. The cost, once again, not free. I'm not saying this is an easy cost for every family, but certainly one that could be manageable. It's going to last you a lifetime. So it could be for many people a small investment in their health and well-being. All of these items are available online. There certainly should have access to them. Last but not least is an incentive spirometer. Many of you may have been given an incentive spirometer or have been recommended to use an incentive spirometer. These are available in hospitals and often in pharmacies and so on and so forth. But there's important to know, there's two different types of spirometers. There are incentive spirometers in which you're simply just blowing into the device and the ball is going up and down. Those often provide no resistance to the force. It's just an opportunity to work the lungs, and the ball is essentially biofeedback. It's to show you that you're in fact blowing through the device. That really does not have therapeutic value. There's no harm, you're not hurting anyone, but it's not giving you that bang for your buck. This type of incentive spirometer here, if you look right here, you're going to see it has a little knob. And here we do have the ability to apply some resistance to the force. So this incentive spirometer is a kind of a mix of all the techniques we've just been talking about. It's easy to use, and it is certainly, once again, affordable. It improves respiratory support, speech, and of course, that transference of swallowing skills. It's really great because you can work for both inhalation and exhalation. And for many people, seeing that ball, holding up the ball, counting how many seconds they're able to keep the ball at the top of the chamber is a really great source of feedback. There's a sense of happiness and accomplishment that you obtain when you see the ball up in the air. Obviously, you will not see that with the EMST or the breather. They're all working in very similar ways to help you. But for certain patients and certain friends of mine, they prefer having that ball up in the air. And you know what? To each their own. If you're working your lungs, you're going to have one happy lady over here in New York. So choose, pick your poison, all have benefit. So some of our loved ones have severely compromised forced vital lung capacity and lung capacity. And I'm certainly aware and cognizant of that. So what I've done here is I kind of ranked for you where you think you may need to start. So an incentive spirometer, which I just showed you, the blue device with the ball, is one of the easier ones for you to work with. You can see that the port for the actual tube. One moment, my 2-year-old just broke in. That's telehealth, everyone. Sorry about that. The incentive spirometer provides us with that large tube, so it's quite easy. And even though we can change the resistance, it's still a really easy place to start. And for many of us and many of our friends, that may be the best place. The breather, because it uses air ports, would be moderate resistance. If the incentive spirometer is too easy, or if you're ready to graduate from the incentive spirometer, the breather would be your next step. And once again, totally customizable, really, really great opportunity to work inhalation and exhalation. The EMST 75 is a little bit lighter than the heavy duty EMST 150. It also provides a lot of moderate resistance. Once again, customizable, but half of what is provided in the EMST 150. And I just want to take a moment and take like a big step back. We are here talking about MS, but can't forget that we are still in the crux of a pandemic, and many, many people that you may know or love may have had COVID. And with that, they have had changes in their respiration. The same protocol that I'm telling you is 100% applicable to many, many other disorders and diseases, but 100% a part of my rehab plan for patients post-COVID. Improving your lungs is always going to benefit our patients, no matter really what that diagnosis is. So EMST, breather, incentive, they all have a wonderful role in lung and respiratory rehabilitation. Full disclosure, my husband's a marathon runner, and many, many athletes are religious about using these type of devices to improve their lung capacity. Swimmers, runners, many, many different athletes. So there's a lot of use. So it's not just perhaps you and I who want to use this. You may have other loved ones who have benefit to this type of respiratory training. So last but not least is compensatory strategies. So everything I presented today have been pretty much cost effective or very minimally invasive to your pocketbook and your wallet. This is totally free. Once again, I love free things. It's a lot of money to live here in New York. So what do we have to do? We have to think smart. So compensatory strategies are free things that we can teach you to use and to implement to lessen the impact of the changes of speech, language, and communication that you may be experiencing. They do not improve the strength of the muscles, and these strategies do not improve the exercise intervention we have been talking about for the last 45 minutes. So I want to be really clear. These are add-ons to the larger home exercise program for you to have. I call them like little aces in the hole. It's like something you can do to help yourself. So there's two techniques that are really helpful for speech clarity, AKA intelligibility. The first is called thinking in boxes, and the second is called tap it out. So let me give you a little bit about both. Thinking in boxes is a technique that teaches our friends and our loved ones to pay close attention to each word, to give each word its own moment, if you will, and to frequently replenish their breath support. We actually physically place a box around each word that we're about to say, or we can use an imaginary, we can use our finger to trace it, or we can even use our eyes to scan around each word. We can use a highlighter to tap each word. There's so many things you can do, but you're going to somehow, some way, place a box around each word. And you're going to learn to finish each word before continuing on to the next. This technique helps you produce instantly louder, clearer, and more precise speech production. So let's have a go together. So can you all see my cursor? Okay. So if I was doing a telehealth session, which is a majority of what I've been doing for many years, but certainly exclusively with what we do now since the pandemic, I would put on the annotate feature in Zoom. That's when essentially I can give you the opportunity to kind of draw on my screen. And I would say, okay, Mrs. Smith, I want you to read this simple sentence for me. And this is what I would have you do with your cursor. I would have you physically draw a box around each word and say it along with the drawing. I would like a drink. Each word has a moment in the spotlight, right? Otherwise, if I had said, Ms. Casey, can you kindly read that sentence for me?
I would like a drink.
Beautiful. Okay. If we weren't doing this technique, what would Miss Casey probably would have said? I would like a drink, right? Totally normal. But when we co-articulate, it makes it really hard for our loved ones to understand us. So when we stop and put a box around each word gets a moment to be appreciated. So that's the foundations. One word, one box. But you can't live at that level forever, right? So if we were in treatment together, I would have you bring your favorite book or a monologue from a play, or maybe you're into horoscopes. We would share on Zoom, read everyone's horoscope from your loved one. And then do some cognitive work. Oh, who's May the 11th? Oh, you're a Taurus. Okay, what's your husband's birthday? We make it fun. It's a good time, right? So we would go through the horoscopes and I would say, okay, Julie, let's do it. Put a box around each word. Read the horoscope. And of course, there's no real boxes there. And once again, she would either have to physically touch the screen, tap the screen, or use the annotate and just touch, but you have to give it its moment to be acknowledged. Then once we're past the single word, which is a little robotic, totally agree, we take it now to giving 2 syllables within the box. Now we're picking up a little bit more naturalness. You can read these words for me. Baseball, listen, hungry, cellar, paper, right? So they're individual words, but they're 2 syllables. So they take a little bit more effort than single syllable words. And at the very top of the hierarchy is phrases. Now we're drawing that box around little phrases that equal 1 sentence. So here would be my example. Take the time to speak clearly. Still nice and controlled, easy to follow. It definitely has a little lag to it, but they say some of the best public speakers are those who are a little bit slower and kind of leave you with bated breath and wanting more. I think this is a very, very lovely way to communicate with your colleagues and your peers. So thinking in boxes, you can do it anywhere. You can do it whether you're reading out loud, whether you're reading to yourself, whether you're reading something at your church or your synagogue, whatever you're doing, you can easily do this by drawing an imaginary box or a physical box around each word. The last technique of our lecture today is about tap it out. I can't begin to tell you all of the amazing experiences I have personally shared with my patients over the years with Tap It Out. It's somewhat similar to thinking in boxes, but it gives you a real level of discreteness. So Tap It Out is tapping your finger in unison with each spoken word. So let's go to our previous slide. I would teach my loved one and my patient to, I would like a drink. When you tap out each word, you can't help but slow down and give attention to each word. You can't help it. You can't speak faster than the tap. It's this miracle motor task where when you're forced to tap out each word, your whole body instantly slows down. You may miss a word here or there as you're learning the technique, but it's very seldom, if ever, that you will find yourself speaking faster than the tapping. That's why we do the tapping. It's the motor act that we need to tell our body to stop, get back, let's get in control. Okay? So you're physically tapping each word. This has to be done physically. What's great is that, many of my friends with MS and other disorders may have challenges in their limbs or their arms, and that's completely fine because all you need to do is be able to do it to yourself, right? It doesn't have to be. Yes, with my therapy, when we start, I want to see the taps. I want you to clap it out. I want to hear it. Right. But the good news is that if you have challenges with fine motor and lower extremities and upper extremities, whatever it may be, this can be done very discreetly. So it will still work. So I like to start by literally clapping or tapping on the surface. And then once my friends start to get the flow of it, you can simply tap your finger on your lap. Imagine you're out for dinner and you really wanted to say something and contribute to that conversation, as you should. What can you do? you can tap out each thing you want to say on your lap and make sure that each word gets the attention it deserves. You can hear when I started tapping, my voice changed, but no one would be like, oh, what are you doing, Marissa? You sound ridiculous, right? No one would say that. They would see that I'm clearly implementing some strategies. After you're tapping on your lap, I've seen a lot of men tap their finger in their pocket. And ultimately, I had a very, very high functioning young man with MS in his 40s who was a trial attorney, and he used to tap his big toe in his shoe when he was at work, and it worked like a charm every time. So there's lots of levels of quote unquote discretion, which I think is fun. So once again, how does it work? You're pairing a speech task with a motor act. And when you do so, innately your body and brain will slow down and you will give greater concentration, energy, and effort to each word. What's the results? Clearer, louder, more precise speech production. So here would be another example. Look at my screen. Can we go to the store now? This tells me where I think I should take a new breath. Can I say it all in one breath? Can we go to the store now? But even me, you could hear at the end, I'm a little pressed for air. And when we ask a question, what do we do with our voice? We typically rise the inflection. Can I go to the store now? Can I go to the store now? We rise it. It's a cue to the world that we're asking a question, right? So it's hard to do those finessey things with our voice when we've got no more air left, right? So this is why I recommend that you breathe. It's free, it's your lungs, do it. Let's try it again. Tap it out. Can we go to the store now? I think it sounds rather lovely and charming and sophisticated. Let's try another one. She just left 5 minutes ago. I would like to watch the television after dinner. Tap, 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 tap. Once again, these are compensatory. They're things that you can put in your mind, literally put in your pocket, cost nothing, but they will never replace the good exercise that all of us should be doing for our lungs and our breath support, because it is the foundations for which we breathe, think, walk, swallow. Everything we do is executed with the integrity of our lungs. So that kind of concludes some of the things that you can do. And most importantly, the science to back that up. I am a woman of science. So I'm going to leave you with these kind of food for thoughts. Speech, language, and swallowing function is common in MS, but it also can be very effectively treated. And that's the super encouraging news. And I don't want anyone to walk away and say, oh, that Dr. B is a Debbie Downer. No, not on my show. It's not at all. For everything that we can say can happen a part of MS, I can tell you a way that we use to help improve that disorder or that symptom. I can tell you that the skills and expertise of speech language pathologists, specifically medical speech pathologists, are tremendously and embarrassingly underutilized in MS care. The use of telehealth now is everywhere. You know, I started telehealth almost 6.5 years ago. And, you know, at the time it was really, you know, me helping people in rural communities, patients with severely limited mobility, or individuals who were really far away from access from an MSCS like myself or the people whom I work with in my practice. But now it's for anyone all over the world. So don't be afraid to reach out and make your network. Telehealth is now reimbursable for the first time. Let's hope it stays there through the end of the pandemic. So just know it really could work to your benefit, a part of your MS care. Some other takeaway points. There are many inexpensive or cost-effective therapeutic treatments that I talked to you about today. Ideally, once again, it would be really important for me to tell you that it's ideal to have a consultation with somebody who can customize the home program for you, but by no means are you hurting yourself by exploring the techniques that we talked about today. This is exercise, and exercise takes what? Consistency. So set a routine, practice every day, same time. You get up, use the bathroom, you brush your teeth, you have your coffee. Well, maybe the new thing every day is you do your EMST, or you do your breather, or you do your sustained Oz. Then you get dressed, then you get your day started, and off you go. Okay? Take data. You too can be a scientist. Take the data, look at the trends. Okay? Every once in a while, record yourself. If you have a smartphone, you have an instant recorder, right? Record yourself. Listen. Okay? And I will say that most individuals with multiple sclerosis truly benefit from having a comprehensive rehabilitation medicine evaluation each year. No one's saying you have to sign up for treatment or therapy, but having a once yearly check-in for PT, OT, and SLP, it's really helpful. And I will say this as somebody who's served as an expert medical witness on more cases that I could possibly talk about. Sometimes having these annual reports, this documentation, can really be killer when we're talking about getting benefits or proving things to the court of law regarding eligibility, reasonable accommodations in the workplace, you name it. So this is a very important thing that you can do, and most insurance providers completely cover a PT, OT, and SLP evaluation annually. Here are some questions to ask yourself every 6 months. Some questions regarding your speech, your volume, and your swallowing skills. When in doubt, if there's anything here that has changed for you, it's time to consult a healthcare professional. And in summary, treatment is most effective when it is administered by an MSCS rehabilitation professional. If there's one not near you, consider the web. Look for information on telehealth. You can do a search for MSCS certified clinicians. They're out there, we're in databases. And most importantly, if you're experiencing a change to your voice, your speech, your cognition, your swallowing, your anything, you are in the driver's seat of your own healthcare. You have to advocate for yourself. You can't say no. You can't roll over. You have to keep fighting and build a team of people who share the passion for advocacy like you. Because I can't tell you how many, possibly thousands of times in the last 15 years, I've had a client or a patient say to me, "Hey, Marissa, hey, Dr. B, I've been experiencing this for 4 years. And my MS doc or my nurse practitioner simply said it was just the way it was, or it wasn't severe enough yet, or it wasn't," and it just and we were here the entire time waiting for to give them the help that they needed. So go out there, advocate for yourself, make your mark on your own personalized rehabilitation, because don't allow changes in communication to withdraw you or your loved ones from conversations and social interactions, because you deserve the best. So that is all. I know we went over by a few minutes. I'm sorry, but my passion takes over. And I wanted to supply all of you with my email, my website, my phone number to my practice, where you can leave a voicemail there for me. More importantly, you always can reach me through my dear colleagues, Deborah and Casey at the MSF Foundation. And without any further ado, I want to make sure I answer your questions. So shall we go back and do that?
Yep. Can I just tell everybody how to do that?
Super.
Thank you. That was fabulous, really helpful information. But now we're ready to take questions. So for those that aren't familiar as to how to do this, if you have a question or a comment, please use the raise hand feature in the app, or you can send your question via chat or the Q&A. I'll unmute you, then a button will appear on your screen asking if you want to allow me to do that. And you'll need to say yes, allow. So let's go.
May I begin real quick, Deborah, by addressing the 2 Q&As that were put in the box earlier, and then once again, answer all other questions. So Nicole indicates, what if asthmatic and short-winded, easily doing an OT exercise? So yes, there's many patients who have chronic obstructive pulmonary disease and many other similar respiratory issues. It's okay. Once again, this is why I always encourage you to consult with an SLP. You're never supposed to be in pain or the part where you are feeling part that you're about to pass out. Start easy, right? Just do it easy. Do it with yourself once or twice and start to feel some confidence. But having a condition like asthma or anything like that does not exclude you from this type of therapy. In fact, this is even more important to help you build your efficient air exchange. And I believe this is being recorded and it's usually shared, and hopefully you can replay it at your leisure.
I'll address that. This session is being recorded. It will be available on the Multiple Sclerosis Foundation's YouTube channel within 2 weeks after it passes our review. And I will share a link to the YouTube channel in the chat in just a moment.
Thank you very much. Okay, and then Jim indicated, how much is MS and sleep apnea connected? I'm a mouth breather and I drool at night, and you have acid reflux. Okay, you've got a lot going on. So obviously I'm unable to give personalized medical advice, but what I can tell you is that there's likely something going on here that requires you to see an ENT first and foremost. You need to find out if you personally have an association between your MS and your sleep apnea. Everyone is different. It could be a yes, it could be a no, it could be an I don't know, but they can help you figure that out. So definitely work with your team to figure out what that association is. You definitely need to work with the ENT in terms of your acid reflux, because acid reflux in particular, there's 2 types. We could do a whole other discussion on GERD. That's for future discussion. And aerodigestive disorders. I have a great friend who does this with me. There's 2 types of GERD. There's true GERD, gastroesophageal reflux disease, where it stays within the food tube, right? And that's that kind of sensation of heartburn. And then for many individuals, that acid can go up and over out of the food tube. And this, in fact, is called LPR, laryngopharyngeal reflux. And that's the people who wake up with the bad taste in their mouth, that sour feeling, and their voice is uber scratchy. That is of the really big concern, because it can eat away at the epithelium of your vocal cords, and it actually can be cancer causing. So get to the doctor, find out what's going on, and that technique, run with it. The sky's the limit. So thank you, Jim, very much for your question. Okay.
I don't see anybody else. Casey, do you see any that I'm missing? No? Okay. We'll give everybody a couple seconds in case they do have something that they'd like to ask you. Okay, well, there's a lot of information you gave. So I'm sure if they have a question, they'll email you or they'll ask their doctors. Okay, well, I guess that's all the time we have for now. If you've missed any part of this conference, it will be replayed on msfocusradio.org. And as Casey said, it'll be available on our YouTube page in a couple weeks, also on demand and on our MS Focus SoundCloud page. So we're also on Twitter, Instagram, and you can watch those for your times and access information, Facebook. Our next teleconference will be a week from today, which is next Thursday, June 17th at 4:00 p.m. The speaker is going to be Augusto Miravalle, and he's an MD. He'll be talking about comprehensive care in MS beyond preventing relapses. Our sincere thanks to all of our attendees for your participation, and also especially to Dr. Barrera. I like the Dr. B. I like.
Oh, that's what everyone calls me, Dr. B. Yeah, I'm Dr. B to about 90 students across the country. Yeah.
kind enough to share this information with us. Thank you, everyone, and have a great day.
Thank you for my opportunity to share all this great information with you. Don't be strangers. Reach out if I can help. Bye from New York.